The VRTX CTO and CTO4 are specially designed to provide increased motion restriction in all three planes of motion. In this video, we will guide you through the step-by-step process of fitting the VRTX CTO and CTO4 to ensure optimal patient comfort and support. First, begin by unlocking all components of the CTO anterior assembly. Ensure the patient's head is in a neutral alignment. Slide the collar up the chest and place under the chin just before the trapezius muscles, ensuring the collar's flex tabs are touching below the sternal notch and the chest panel is over the xiphoid process. While holding the collar against the patient's chest, turn the dial clockwise to raise the chin piece. Once the chin piece is supporting the chin, release the dial. Next, position the collar back panel by pressing the collar back panel down onto the bed and slide it behind the patient's neck. The loop straps should be positioned between the patient's ear and the trapezius muscles. Fasten the straps on each side, ensuring both sides are tightened equally for a snug and symmetrical fit. Once the collar is at the proper height, the chest piece is in the correct location, and the cervical spine is secure. Squeeze the yoke back together to lock in the custom angle and lock in the chest panel height. When positioning the back lumbar panel, slide the back panel under the lumbar spine. Attach the back panel clips to the sides of the vest. Pull the straps evenly until the back panel is tightened. Adjust the strap padding for comfort. When the patient is going from supine to sitting, unlock the chest panel to enable vertical height adjustment. Once the desired vertical height is attained, slide the lock to set the chest panel height. The VRTX CTO can also be stepped up as needed to a VRTX CTO4 post to provide more motion restriction to the cervical and thoracic spine. First, begin by approximating the height of the posterior assembly by pushing down on the button. On the back side, with the other hand, pry back to fully release. Adjust the strut up or down. If necessary, bend the metal strut for optimal fit. While maintaining neutral alignment and with proper support, log roll the patient onto their side. Position the posterior assembly and the collar back panel on the patient. If necessary, adjust the length. Confirm adjustment buttons are secure following any adjustment. Log roll the patient back onto their back. Tighten both collar straps and clip in the anterior assembly as detailed previously. Remove the brace by first removing the hook and loop straps from one side and unclipping one of the clips found on the CTO vest. To reapply the VRTX CTO, simply hold the front of the collar on yourself and with the loose strap, wrap the brace around your body. Tighten the hook and loop straps on the collar and clip in the clips found on the CTO vest. Tighten to desired level of comfort as needed. If upgrading from a CTO 2 post to a 4 post, apply pressure to the yoke lock clips found behind the posterior panel. Lift and remove yoke lock. Attach the posterior strut to the posterior panel of the collar by inserting the yoke from the top of the collar slots. Insert the yoke lock with gentle pressure until it snaps into place. To clean the VRTX CTO and CTO4 pads, wipe with a damp cloth and mild soap. Wipe off excess with clean water. Allow to fully air dry. For more information regarding the VRTX CTO, please visit aspenmp.com.